Hello, my name is Mitchell Levine. I'm an instructor with the Nassau County EMS Academy. I'm going to be demonstrating Skills Station 1A of the New York State EMT exam. I make my general impression. I see a male patient in his 50s in a tripod position, possibly with respiratory difficulty, possible cardiac. I assess the patient's AFPU status. As I approach the scene, he is aware of my being there, therefore he is alert, and at this time I make note that there's no need for an external airway adjunct. I begin my patient's respiratory assessment by auscultating the upper right and left region of his chest. Auscultation on the upper right, auscultation on the upper left, and I make note of some respiratory difficulty. I continue to check the patient's equal rise and fall of his chest, and I find it to be equally noted. And at this time, there's no indication for exposing the patient's chest for further physical examination. I apply a non-rebreather mask set at 15 liters per minute, and then continue my assessment of the patient's circulatory status. I assess the patient's circulatory status by checking his radial pulse. It is present, it is strong. I make note of the patient's skin, temperature, color, and moisture, and note it to be mildly diaphoretic with some paleness to his skin. I note that there is no signs of major external bleeding. I would make note that this is a medical transport for possible respiratory or cardiac complications. I would make this a rapid transport, and I would advise my team to bring in a stretcher or stair chair if necessary to transport this patient. While they're doing that, I would continue my assessment. At this time, I'm going to start with my sample history and my OPQ-RSTI. Sir, can you tell me what you're feeling at this time?
Chest pain and difficulty breathing.
Do you have any allergies to medication?
No.
Are you currently taking any medication for cardiac or respiratory problems?
I'm taking Nitro.
Besides Nitro, do you take any other medication?
No.
Okay. Do you have any other cardiac complications or respiratory complications?
No.
So you strictly have AFib, SAMPL. When did you last eat?
2 hours ago.
Okay. And what were you doing when this problem began today?
I was just taking the dog for a walk.
Okay, so mild exertion. All right, now go into my OPQ-RST. The onset. How long ago did you take your dog for a walk?
About an hour ago.
And the pain began, or the difficulty began suddenly?
Yes.
So it's an acute onset. OP. Anything make it better or worse?
I'm sitting down and I'm leaning forward a little bit, and that's helping me a little bit, but not much.
Good. And can you describe it to me?
It's like a sharp pain.
A sharp pain. And can you show me where that pain is?
It's
and
right
does it
here.
travel anywhere?
Yeah, it's kind of right by my shoulder.
OPQ-RS, on a scale of 1 to 10, 10 being the worst pain in the world, how would you describe it on a number scale?
Probably an 8 when I was walking my dog.
And now?
Now it's, give it a 6.
Okay, OPQ-RST. Did you take anything when this pain or discomfort began?
No.
Now you said you were prescribed Nitro,
Yes.
and you did not yet take it.
No, I didn't know if I should.
Okay, we will see if that's necessary. At this time, I'm going to take your vital signs. I want you to sit back, I want you to relax, and breathe comfortably with the oxygen on you. We're going to start with your vital signs while my team is preparing to transport you.
Okay.
Once I'm finished taking the patient's pulse rate times 30 seconds if it's regular, and multiplying times 2, I will continue to assess the patient's respiratory rate. I would assess the patient's quality of respirations by listening in 6 lung sites. Sir, if you can, open your mouth, take a deep breath all the way in, and slowly all the way out. Again, if you can, In and out, nice and easy. Midclavicular low on the left, midclavicular low on the right, and mid-axillary on the right, mid-axillary on the left. I would once again assess the patient's skin temperature, color, and moisture content. Check the patient's SpO2 level, and based upon my findings of blood pressure, I would then consider Nitro by going through Nitro protocol. You have your Nitro with you, sir?
Yes.
Okay, your blood pressure is over 120. I'm going to ask you to take one Nitro pill under your tongue. First, I want to verify that you have not taken any ED medication within the last 72 hours.
No, I haven't.
Okay, I'm going to put one pill under your tongue, let it dissolve there, and we'll reassess that soon. At this point, I'm going to consider aspirin protocol. Sir, do you have any allergies to aspirin?
No.
Do you have any history of upper GI bleeding?
No.
If the Nitro is no longer in his mouth, I'm going to give the patient 325 milligrams of non-enteric-coated aspirin and ask him to chew them. At this point, we would continue our transportation. I'm going to continue to assess you for jugular vein distension that could be related to heart failure. I'm also going to check you for pedal edema that could also be related to heart failure, examining and evaluating both of your feet. We are en route to the hospital at this time. I'm going to continue to assess your AVPU, ABCs. I'm going to continue to check your vital signs once every 5 minutes since this is a critical call. And I'm going to check on the interventions. Is the oxygen therapy still in place? I'm going to assess your vital signs and make sure and see if you qualify for a second dose of Nitro sublingually. And I'm going to notify the hospital of our estimated time of arrival and the condition of the patient. At this time, this concludes the medical assessment.